queen bees and some problems. One more video from Beekeeping Without Borders for beekeepers around the world. It is very important to monitor the different causes, some of them pathological, that cause the queen to lose its functionality and thereby endanger the viability or productivity of the hive. It is very important to monitor the different causes, some of them pathological, that cause the queen to lose its functionality and thereby endanger the viability or productivity of the hive. For all this, it is evident that the entire colony can be affected and even die if its queen has defects in her body or if she gets sick. The concern has its explanation if we take into account that the queen is the only element of the colony that has well-developed sexual organs, and that after coupling she can lay fertilized eggs from which workers are born and, under different circumstances, unfertilized eggs that will produce drone result. There are several infectious diseases, metabolic disorders, malformations, or hereditary anomalies, which hardly manifest themselves in their descendants. Zanganera queen. It is one of the most frequent disorders in the queen's reproductive activity, that is, the partial or total inability to produce female offspring. There are several causes of this disorder. Lack of mating. When the queens that have to make the exits to mate with the drones cannot do so, due to various circumstances, they do not fertilize the eggs, and although they are prolific, they only produce drones. Insufficient insemination. The number of sperm for the spermatheca to fill is 5 to 6 million, and this load is enough to fertilize the eggs for 4 to 5 years. Now, if due to different circumstances the sperm load is lower, the reserve is soon exhausted and the laying is hesitant and discontinuous to end with a slow laying and a total cessation of laying. Drowning queen due to illness. Many of these queens stop laying. Examining the spermatheca, it has been observed that the sperm are not grouped together, as is normal, but rather they are coiled, forming ring-shaped sperm. Parasitic melanosis or melanosis H, caused by a yeast-like microorganism. The ovaries present very typical, tuberculiform foci of brown-black or black color. Affected queens stop laying within a few days and become sterile. Nosomosis. It is the most common intestinal disease in all elements of the hive. It has the same characteristics in the queen as in the worker bees. Due to the metabolic disorder caused by the disease, the ovaries are affected and their degeneration makes the queens sterile. Anomalies and malformations in bees, as in all living beings, there are very diverse deviations from the normal, and according to their degree they are called anomalies or malformations. These deviations from normal may be due to genetic or environmentally induced causes. Although both anomalies and malformations, with some exceptions, are unimportant in beekeeping practice, it is good to know them and take them into account for a better development of beekeeping and an improvement in the inheritance process linked to the breeding of bees. Queens. Dwarf queens are those that are bred in periods of scarcity and barely reach the size of a worker bee. Their reproductive organs are so small that they do not fulfill their function, and the queens do not mate and remain sterile. Their presence, not known, may be the cause of the colony's continued rejection of the introduction of new queens. Other factors, such as temperature, humidity, or oxygen level, influence the future of the queens that are currently being raised. Temporarily cooled queens cause queens to be born with truncated wings. This truncation can also be due to a mutation. Other anomalies involve independent and uncoordinated growth of reproductive structures. They result in a lack of connection between the ovaries and the oviducts. In these cases, mating is possible, but oviposition is not. A less common case is hypoplasia of the ovaries, with the rest of the structures developing normally. Their deformation is due to early degeneration of their germ cells. A new alteration is gynandromorphism presented by individuals in the colony whose internal and external structure coexist with male and female characteristics. The causes are not known and its presentation is anecdotal. In the same way you can talk about cyclopismo. In this case, we not only have alterations in the eyes are united into one, but the brain, ganglia, and other organs are also altered. Although these are genetic causes, we must not forget that in higher animals these problems occur due to lack of oxygen during development. Albino drones, larvae that do not reach term, stunted offspring, are other anomalies that occur with a very low incidence. Another video of beekeeping without borders, for beekeepers around the world.